We are so excited for today's event to sit down and have a good conversation over just a little bit of coffee. And we're really going to be talking about decision points and experiences. We have Shawn Smith, who is the CEO of One True Health, who is joining us today.
Good morning and congratulations. What a great forum to reach out to your customers and prospective customers. It's an honor to be with you guys today.
Well, and we're just so grateful that you took some time out on your Friday to come join us, especially for this particular conversation. One of the things that we've been talking about so much lately on our team is about experiences, care experiences. And it's for the care team, it's for the patient, and for the organization itself. And I think your story resonates in all of those levels. So I'm looking forward to hearing that today. But let's start. For those who don't know you, and I can't imagine they wouldn't, but you're in for a treat. Shawn, why don't you tell us a little bit about yourself and One True Health?
Well, and again, thank you, Julie and Rich and Ashley, for everything you guys are doing. My name is Shawn Smith. I'm the CEO of One True Health out of Austin, Texas. My background, I have been in healthcare technology and healthcare clinical services since 1987. So 35 years in this industry. Started out selling patient care systems on mainframes. That'll tell you how much gray hair I have and how dated I am. Went on from there to work with integration technologies, with emergency department information systems, clinical terminologies. In 2002, I started my first company. That was post 9/11 in the emergency medical response space. So if you remember the anthrax and smallpox issues, we created a syndromic surveillance technology to identify signs and symptoms of disease outbreaks. That kind of morphed into an emergency management logistics application that was used by American Red Cross, World Vision, Samaritan's Purse, and others. Really, really gratifying work. At World Vision, after the 2010 earthquake, all of their distributions were managed through our software. So just really exciting stuff. Sold that company in 2015 and continued on serial entrepreneur-wise, starting additional companies. We're now in the long-term acute care space, revenue cycle management space, and this is now my fourth startup company, One True Health, that we launched in September of 2020. And at One True Health, we're focused on providing virtual first preventative care through delightful services and intelligent software. And it's mostly focused on Medicare-eligible populations, people suffering from chronic and acute conditions, but really solving the problems. Our actual customers are clinical practices, hospitals, and senior living communities. And they're suffering from two issues here. All happened during COVID. Number one is clinical staffing. So you've heard the stories with the Great Resignation, nurses that departed, case managers that departed, especially in rural communities where healthcare access was already a challenge and staffing was already a challenge. They just don't have the personnel to follow the patient home to help them manage their chronic and acute conditions. And that's going to lead to a big issue into our emergency departments across the nation. Add to that the second issue, which is patient engagement. 40% of American seniors didn't see a physician in person or through telehealth during the pandemic. So you have a lot of organizations that have a hard time just reacquiring that patient and bringing them into their health system in a manner that is effective for in-person encounters. So what we do is we provide a private label end-to-end turnkey clinical services enhanced and supported by technology that solves those problems. We come alongside and we do chronic care management. We provide remote patient monitoring. We do transitional care management on behalf of practices, hospitals, and senior living communities. We help them to reconnect and re-engage with their patients and bring them back into the health system and in a less hair on fire manner that's better, more helpful for the patient, gives them better service, and also allows them to reacquire lost COVID revenue and to bring the patient back into a more standard way of delivering care. So that's who I am and who we are.